3 things about unsteady walking that almost nobody gets right. First, if you stumble crossing a flat parking lot, the problem is not in your legs, not even close. Second, your brain weighs about 2% of your body, yet it pulls in roughly 20% of every breath of oxygen you take. Starve it of even a small fraction of that day after day, year after year, and your walking goes sideways before anything else in your body does. Third, there is a part of your brain the size of a small fist that holds more nerve cells than the rest of your brain combined. When its blood supply drops, you stumble. When you restore that supply, the stumbling stops. That is the whole story. And by the time we are done here, you will know exactly what is happening inside you and exactly which moves to make starting today. If clear, honest health information is what you came for, hit subscribe and leave a like. That is what helps this channel grow. 300,000 subscribers is the goal here on Dr. Waterling, and you being here right now is part of that. Checklists and practical posts go out on my Telegram. The QR code is right there on your screen. Let me start with the single biggest mistake people make when they first notice their walking is off. Someone in their 60s suddenly drifts a little to the left walking down a hallway. They catch a toe on a rug they have crossed 1,000 times. They reach for the railing on the stairs because something just feels less steady than it used to. And almost every single time, the first reaction is the same. They decide their legs are getting weak, so they start doing squats. They buy calcium tablets. They look up balance exercises online and stand on one foot in the kitchen. A month later, nothing has changed. The wobble is still there. The toe is still catching. Here is why none of that worked. The legs were never the problem. Picture 3 people in a row who cannot walk in a straight line. The first is recovering from a stroke. The second is a guy at a wedding who has had 5 too many. The third is a 10-month-old baby pulling herself up at the coffee table for the first time. All 3 wobble. All 3 drift. And anyone watching them would tell you instantly that what is going on with each one is completely different. 3 different causes, 3 different stories, same outward symptom. Uncoordinated walking. That is the point. Unsteady walking is a symptom. It is not a diagnosis. Treating it like a diagnosis and assuming it must be the legs is exactly why people spin their wheels for months and feel worse instead of better. Try this thought experiment with me. Take a perfectly healthy person and ask them to stand on one foot. They stand there. Other foot in the air, arms relaxed, completely steady. Now take someone with a coordination problem and ask them to walk down a wide, empty hallway. 2 legs on the floor, full support, no obstacle in sight, and they veer off to one side anyway. What is the difference? In both cases, the legs are working. The bones are intact, the muscles are firing. What changed is who is running the show. Your muscles and your bones are hardware, beautifully engineered hardware, refined over millions of years. But hardware does not know what to do on its own. It needs a controller. It needs a command center. That command center is your brain and one specific part of it in particular. It is called the cerebellum. The cerebellum is your personal balance computer. Every fraction of a second, it is pulling in a flood of data from your muscles, your joints, your eyes, and your inner ears. It compares all of that against where you intended to go, and it sends out tiny corrections to this calf muscle, to that hip, to the angle of your shoulder that keep you upright and pointed the right way. When the cerebellum is running smoothly, you walk without thinking about it. When it starts running underpowered, you stumble. Here's something about walking that most people have never actually stopped to consider. Walking is controlled falling. That is not poetry. That is the literal description of what your body is doing every time you take a step. You lean forward, your center of gravity moves out past your foot. For a split second, you are falling. And in that exact moment, your back leg swings forward and catches you. Then the cycle repeats. Falling, catching. Falling, catching. The cerebellum is the structure timing that catch, putting the right leg in the right place at the right millisecond. If that timing slips even a little, you stumble. If it slips badly, you fall. This is also why babies fall down so much when they are learning to walk. Their legs are perfectly fine. Their cerebellum just has not built the program yet. Over the next year, that little computer gets trained, the patterns become automatic, and the falling stops. Now jump forward 60 years. Coordination problems can come back. And the second time around, it is not about learning anything. It is about supply. The parts of the brain that run movement, the cerebellum included, start getting less oxygen than they used to, and a brain region running on reduced oxygen simply does its job worse. Your brain is an organ, same as your heart, same as your liver, same as your kidneys. It needs blood flow to function. The number that always gets people's attention is this. Your brain accounts for around 2% of your total body weight, but it consumes roughly 20% of the oxygen you breathe. 20%! That tells you how astonishingly sensitive this organ is to even a small chronic drop in supply. Cut it by a slim margin, hold that cut for years, and your brain starts to underperform in very specific ways. And here is what shows up in clinical records over and over. People who come in for unsteady walking almost always have other symptoms they had never connected to it. The first is short-term memory slipping. You walk into the kitchen and genuinely cannot remember what you went in there for. You start saying something to your spouse and lose the thread halfway through the sentence. You used to be sharp as a tack. Now there is a beat of hesitation that was not there before. Short-term memory needs active, real-time energy delivery. It is one of the first things to slip when blood flow dips. The second is mental fatigue. The kind of work you used to handle on autopilot now feels heavier. By 2 or 3 in the afternoon, your brain feels like a phone battery in cold weather. Still technically on, but not putting out anything close to full power. The third is brain fog. People describe it as thinking through wet cotton. Everything is just slightly slower. The thoughts are there, but they take an extra second to come into focus. If any of those sound familiar, pay attention. This is not a reason to panic. It is a reason to act. Because in most cases, this is not some inevitable slide. There is a specific mechanical reason it is happening, and there is something you can do about it. Let me tell you what the cerebellum actually is, because most people have no real picture of it. It sits at the back of your skull, low down, tucked under the back of your big cerebral hemispheres. By volume, it is about 10% of your brain. But here is the wild part. By number of nerve cells, it holds more than half of all the neurons in your entire central nervous system. More than 50% of your processing units packed into about 10% of the space. The cerebellum is the densest piece of computing equipment you own. And when it gets shortchanged on blood, you feel the effect right away. There is a case from primary care notes that lays this out perfectly. A woman in her mid-40s, call her Carol, went to her family doctor for what she called just clumsiness. She had been bumping into door frames in her own house. She was dropping the coffee mug for no reason. Her walking had developed a slight drift she could not explain. She was told she was probably tired and to exercise more. She did. Nothing changed. When someone finally took a full history, she also mentioned she had been losing words mid-sentence for almost a year and crashing every afternoon by 2 o'clock, even though she was sleeping a solid 8 hours every night. She had not connected any of those things to each other. They were all the same problem. The blood supply to her cerebellum was being squeezed off at the level of her neck, and that whole region was working at maybe 60% of its capacity. Once the mechanical restriction in her neck was addressed over several weeks, with coordination training added on top, the change in her was visible to her family within a month. She walked straight. Words came back. The afternoon crash faded. That is what restoring blood flow to the cerebellum looks like in a real person living a real life. So why the neck? Why does the neck end up being the key to all of this? Pure anatomy. There are 2 arteries that feed the entire back portion of your brain. They are called the vertebral arteries. And here's the thing that makes them unlike any other artery in your body. They do not run alongside your spine. They run through it. There are small holes in the side projections of each of your neck vertebrae, and the vertebral arteries thread up through those holes bone by bone all the way to the top of your neck. Then they loop around the very first vertebra, the one your skull sits on, and slip into the base of the skull. Once inside, the 2 of them come together into a single, larger vessel called the basilar artery. That basilar artery is what supplies your cerebellum, your brainstem, and the back regions of your brain. The whole system has a name, vertebro-basilar circulation. Take a second and let the structure of that sink in. The artery feeding your balance computer is threaded through bone, through your cervical vertebrae, which means if there is tension in those vertebrae, chronic muscle spasm, stiffness in the joints, restricted mobility, the artery is affected. A vertebra shifts a couple of millimeters. A muscle stays chronically clenched. The artery picks up a small kink. The inside diameter of the vessel narrows a fraction. Not dramatically, not stroke level, but chronically, persistently for months and years. And that slow, quiet reduction in blood flow is exactly what produces the symptoms you have been hearing about. The mission becomes mechanical. Remove the restriction in the neck. Restore the natural alignment. Blood flow improves. The cerebellum gets a fuller supply. Coordination improves. It really is that direct of a chain. Before we get to the exercises, I want to flag where well-intentioned people go wrong even when they are trying to do the right thing. When someone feels stiffness in their neck and decides to stretch it, they usually do the same set of moves. Tilt the head forward, pull one ear down toward the shoulder, roll the neck in a circle. All of that movement happens at the middle part of the cervical spine, the 5th and 6th vertebrae. That segment is already the most mobile part of your neck. It carries the most daily load. Throwing more movement at it does basically nothing for the actual problem. And if you really crank on it, you can make things worse. The restrictions that matter are somewhere else entirely. The first problem zone is what is called the cervicothoracic junction, the place where the bottom of your neck meets the top of your upper back. Roughly the 6th and 7th cervical vertebrae and the 1st and 2nd thoracic vertebrae. This is where chronic mechanical blocks actually settle in. It is also where that visible bump at the base of the neck builds up, the one people sometimes call a dowager's hump. That bump is not fat. It is a thick, layered mechanical lockup in the muscles, ligaments, and joint capsules of that transition zone. And it sits right on top of where the vertebral arteries are running. The second problem zone is the very top of your spine. The 1st and 2nd cervical vertebrae, right under your skull. That is where the vertebral arteries make their final sharp bend before disappearing into the back of your head. A restriction at that exact spot affects flow at the last possible moment before the blood reaches the cerebellum. So we have two jobs in front of us. Block 1, release the neck, specifically at those two locked zones. Block 2, train the cerebellum itself, the way you would train a muscle. Start with block 1, releasing the cervicothoracic junction. The first move requires that you find your 7th cervical vertebra. This is easy. Tip your chin slightly toward your chest and run a finger down the back of your neck until you hit the base. There will be one bony knob that sticks out noticeably more than the ones above and below it. That is the 7th cervical vertebra, and in the anatomy textbooks, it is literally called the prominent vertebra, because that is how clearly you can feel it. Here is the principle of what you are about to do. When you turn your head, the cervical vertebrae are supposed to rotate along with you, but the lower ones rotate much less than the upper ones. Their connective tissue is tighter, their range is naturally smaller, so they tend to lag behind. Your job is to give them a little nudge so they participate. Place the pad of your finger on the side of that prominent vertebra. Slowly turn your head to one side, let us say the right. As your head turns, apply a very light pressure with your finger to the right side of that bone, helping it rotate in the same direction your head is already going. The key word there is light. The ligaments between vertebrae are elastic. They give like a firm rubber band. You are looking for the moment when you feel a soft, elastic resistance under your finger. That is the end point. You do not push through it. You hold it there. When you bring your head back to center, do not let your finger off the bone right away. Keep holding the vertebra steady as your head comes home. That extra little stretch on the joint capsule is where the actual therapeutic effect lives. Move down one to the next vertebra below and repeat. Same gentle assistance. Move down one more. Be even gentler at the lower levels because they participate even less in rotation. The whole cervicothoracic junction contributes only about 5 to 10% of the total range of motion in your neck. A small share, but a disproportionate effect. Free this zone up and everything above it feels different. Bonus, this junction is wired directly into your shoulder girdle, so people who do this consistently often notice their shoulders moving better too. Move 2, stretching the side of the neck. A neck muscle that has been chronically clenched for years presses on everything around it, and yes, that includes the vertebral arteries. So a careful, correct stretch is not a comfort thing, it is direct therapy. Place one hand flat on your collarbone on one side and press it gently downward. Now slowly, no jerking, no bouncing, tilt your head to the opposite side and lift your chin slightly toward the ceiling. You should feel a clean stretch run down the front and side of your neck. The muscle you are stretching has a long name, the Sternocleidomastoid. It runs from just behind your ear all the way down to your collarbone and breastbone. When it is chronically tight, it drags your head forward and compresses everything in the front of your neck. Hold the stretch at a level of tension that is firm, but absolutely not painful. Breathe normally. Then release and try a slightly different angle, a little more tilt toward the back this time to catch the rear edge of the muscle. Then switch sides. What you do not want to do is just drop your ear straight down toward your shoulder. That is the move that loads the middle of your neck more, exactly the segment that is already overloaded. Finish with self-massage. Reach both hands around the back of your neck, place your fingertips on either side of the spine, and work the muscle bands with a firm but easy kneading pressure. That completes the release work. When you put time into your neck, remember what you are actually doing. This is not just a stiff joint that needs limbering up. The neck is the corridor the entire conversation between your brain and your body has to travel through. Every blood vessel and nerve pathway passes there. Free up the neck and you improve cerebral blood flow. That means sharper memory, clearer thinking, better mood, better circulation to the scalp and to the skin of your face. One area worked on, several places that feel different. Now block 2. We have opened up the supply line. Now we need to actually train the equipment that uses that supply. Here is the wonderful thing about the cerebellum. It responds to training the same way a muscle does. Give it a task that pushes the edge of what it can currently handle, and it adapts. It cranks up its own metabolic activity. It strengthens the neural connections it already has. It builds new ones. The fancy word for this is neuroplasticity, the brain's ability to physically rewire itself in response to demand. The cerebellum has enormous neuroplastic capacity. Give it the right stimulus consistently and it responds quickly. First training move, pelvic rotation with arm and leg coordination. Stand with your feet about shoulder width apart. Start rotating your hips in a slow, smooth circle, like you are loosening up before a stretch. Now pay attention to what your legs naturally want to do. A rotating pelvis sets up a stepping rhythm. One leg wants to swing forward and out in sync with the hip motion. Let it happen. Add that small stepping circle. Now you have 2 patterns going at once, hip rotation and leg sweep, each in its own rhythm. Now layer on your arms. Start making alternating drumming motions with your hands. Right hand, left hand, in a beat that is independent of your legs and hips. 3 motion patterns running at the same time, none of them locked to the others. The first few times you try this, the rhythms will crash into each other. You will lose one while trying to hold the others. That collision is not failure. That is the cerebellum working right at the edge of its current ability, and that is exactly the training zone. Each day you do this, it gets slightly smoother. When it finally feels easy, and it will, that means new neural circuits have actually been built inside your head. Second training move, spotting turns. You have probably seen this done in ballet or figure skating without knowing what it was called. Professional dancers can spin through dozens of rotations and walk off the floor without stumbling. They are not built fundamentally differently from you. They were trained differently. The trick is called spotting. Here is the mechanics. During a turn, the head does not rotate continuously with the rest of the body. Instead, the eyes lock onto a fixed point, a spot on the wall, and hold there as long as physically possible while the body keeps rotating underneath. Then the head snaps quickly forward and finds that same spot again. This breaks up the continuous spinning signal that would otherwise be sent to your inner ear, and your brain keeps its sense of where you are in space. Pick a fixed point on a wall in front of you, a picture frame, a doorknob, anything stationary. Lock your eyes on it. Take 3 steps and make a full rotation. The instant you complete the turn, find your spot again. Build speed slowly over time, then reverse direction. After a few turns, you may feel a mild dizziness. Here is what is happening inside your head. Deep in your inner ear are three loop-shaped structures called the semicircular canals, filled with a fluid called endolymph. When you spin, that fluid starts moving. When you stop spinning, the fluid keeps moving for a moment by sheer inertia, which presses on tiny hair cells that detect rotation, and your brain reads that lingering motion as continued spinning, even though you have stopped. With training, those hair cells adapt. They get less reactive to rapid changes in fluid motion. Over time, you can make more and more rotations with zero dizziness afterward. This is a learned, trainable change in your nervous system. Third training move, advanced level, Sufi spinning. This is one of the oldest documented movement practices in human history. Sufi dervishes, a mystical tradition within Islam, used continuous spinning as a form of meditation and spiritual practice. They would spin for 10 or 15 minutes at a time, at considerable speed, without stopping, without falling, without losing their sense of where they were in the room. From a neuroscience standpoint, this is about the most demanding stimulus you can put on your vestibular system and your cerebellum. Someone who has genuinely built up to mastering this has trained those systems so far past normal that walking on uneven ground in the dark is a non-event for them. If a deeper video on the correct progression, technique, and physiology of this practice would be useful to you, drop a comment below and I will put it together. Before we close, one more thing that is clinically important. Age matters here, and it shapes what the right starting point looks like for you. Blood supply to the cerebellum tends to decrease gradually as we get older because the vertebral arteries, like every other artery in your body, slowly lose some of their elasticity, and the tissues around them get stiffer over the decades. In people under 40, coordination issues usually trace back to a more acute kind of restriction. Bad posture habits, an old injury that never fully resolved, years of being hunched at a desk. In people over 60, it tends to be a chronic, layered pattern. Decades of accumulated stiffness pressing on the vertebro-basilar system. Both groups benefit from the work we just covered, but older folks need more patience, gentler progression, and a conversation with a physician to rule out other contributors before starting. So where do you land in that range? How old are you? Drop your age in the comments. It honestly changes which part of this protocol I would tell you to prioritize, and it helps shape what gets covered in future videos for the audience actually showing up here. Here's what to take with you from today. If you stumble when you walk, if you drift sideways or catch your foot on flat ground or feel less steady than you used to, the problem is blood supply to your cerebellum, running through the vertebral arteries in your neck. The most common cause is mechanical restriction in two specific zones, the cervicothoracic junction at the base of the neck and the upper cervical spine right under the skull that pinches the artery and reduces flow. The fix has two parts. Free the restriction, train the cerebellum. A reasonable daily approach to discuss with your doctor would be something like this. 2 to 3 minutes a day mobilizing the cervicothoracic junction with the gentle finger-assisted rotation. Add the sternocleidomastoid stretch and finish with self-massage at the back of the neck. Then train coordination, the 3-pattern pelvic rotation move, spotting turns when you are ready, and Sufi spinning at the more advanced stage. Done consistently, results usually come faster than people expect because the cerebellum is remarkably responsive once its blood supply is restored. Everything in this video is meant to be information that helps you ask better questions at your next appointment, not a replacement for that appointment with someone who actually knows your full health picture. If this gave you something useful, hit subscribe and leave a like. That is what helps more people find this channel. 300,000 subscribers is where we are headed, and you being here matters. Grab the checklist on my Telegram. The QR code is right there on your screen.